Why not to get induced? I gotta say, induction sounds real good when you start to get towards the end zone of your pregnancy. That last month of pregnancy is pretty darn annoying. So today I'm going to give you 5 reasons to not get induced in case you're looking for them. However, if you're planning on an elective induction after 39 weeks of pregnancy, no hate here. I am here for that too. And you're probably in your 3rd trimester if you're thinking about things like induction. So grab my 3rd trimester prep pack. I'll link it down below. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm here to get you prepared, not scared, for your upcoming hospital birth. And I have had babies both spontaneously and with an induction, so I also speak from my own experience. Not to mention thousands of inductions at the hospital, so it's something I really understand. Of course, before you have an induction, because it is always your choice to have an induction, not your provider's choice, you're going to want to know the risks, the benefits, and the alternatives. I have a whole induction checklist that if you're thinking of an induction, I would definitely go over with your provider so that you know what to expect and you're not there begging for a C-section just a few hours in. Okay, the first reason to not get induced is that inductions happen in the hospital. So if you are not a fan of the hospital or being at the hospital, it may be a reason that an induction just is not for you. Now, birth priorities are really important. If you prefer not to be in the hospital, I think that's an important thing to validate in yourself. I totally get that. In fact, I preferred so much not going to the hospital that I had my appendix rupture at home because I was sure that was not my problem and I really didn't want to go to the hospital. So I'm here to tell you that sometimes you need to go to the hospital, which I ultimately ended up doing. But I get it. If the hospital kind of creeps you out, maybe you want to try to avoid it. The second reason is that inductions give up some control. When you make the choice to be induced, there are other things that you are sort of consenting to at the same point in time. Most of that includes an IV and monitoring the baby basically constantly while you're being induced. So there are things that you cannot make the choice about if you're being induced. If you were to go to the hospital and say, I want to be induced, but you can't monitor my baby, I as a nurse cannot do that because in order to give you the induction agents, I have to have your baby on the monitor. And I know people online are all going to say the hospital policy doesn't matter, but me as a nurse just won't do it because I will lose my license. So I think that's something just really important to be aware of when you get induced. Number 3 is that an induction birth is a higher risk birth. You just need to know that going in. We are forcing your uterus to do something that Mother Nature has not made it do. Now, is that bad? No, a lot of people really need to be induced. And if you're watching this video because you have preeclampsia or baby's just not growing well in the womb or something medically is going on, I don't want you to watch this video to scare you. I'm not here to do that. I've seen plenty of successful inductions at the hospital, but it is important to know that it increases your risk for a C-section or problems at birth when you are getting induced. And that might be a reason why you don't want to get induced, but it's definitely something to talk with your provider if you have concerns about. We in the hospital are doing lots of things to mitigate this risk. That's part of why we have to monitor the baby and monitor how many contractions you're having and how frequent they are. We don't want your risk to end up being bad, but we do know there is an increased risk with inductions. Side note, if you've looked at the ARRIVE trial, which by the way, I have a whole bonus video in the online prenatal class for couples, it did show that a 39-week elective, which means you choose, induction, didn't have an increased risk of a C-section. Now, that study is very controversial, but I think the results matter. If you're 39 weeks, maybe your risk really isn't that higher with an induction. Number 4 is that inductions mean that we do more things to you. Again, we have to put in that IV. We have to monitor the baby, which means we have to move the monitors to make sure that we're watching the baby. So we're just kind of around you more. In fact, with an induction, we have to chart things every 15 minutes on you. By the way, at the regular hospital, a lot of times they're only charting on you once a shift. But in labor and delivery, we're charting every 15 minutes if you're having an induction. So we're just in the room more, we're doing more, we're futzing with your IV more of that, just so you guys know. By the way, this is one of the reasons that I think it is so important if you're even considering an induction, honestly, if you're going into labor, that you take a birth class. You really need to know how those interventions work and what to expect in the hospital because they can be scary. And I don't want that for you. I call it the scary stack when you don't know how to put on the hospital gown. You don't know what the IV is doing. Suddenly 4 nurses run in the room and turn you and you're freaking out because if that happened anywhere else in the hospital, it would be disconcerting, but that is just a regular hour in labor and delivery. It's things that we do frequently. If you understand, they make make sense and you don't have to be scared of them. That's why taking a high quality birth class can really help you out. Come join me in the online prenatal class for couples. It's the easy way to get prepared for your hospital birth. Finally, inductions aren't nature's way. Now, I believed this way for a long time. I will admit that the Arrive trial did make me rethink things, and I also believe that people deserve to have the choice. If you're absolutely miserable at 39 weeks, get that baby out. Studies prove that it should be pretty darn safe. But I think it's important to acknowledge that this isn't how Mother Nature meant for babies to come out. Now, I am a hater of the people who are all like, your body was built to do this. That's tough for a lot of people to hear because some people's bodies just really were not built to birth, or at least they feel that way. But I am a big fan of letting Mother Nature do her thing. So much so that I stayed at my house while my appendix ruptured. So again, we got to have balance in these things, right, guys? Now, a lot of you may have heard that an induction is more painful than regular labor, but that is not one of the reasons that I have here. In fact, I have a whole video about it that I want you guys to check out. Do you think that an induction is more painful than natural birth? Tell us down in the comments. We'll see you around.